Sandra Fitzgerald, I have bad knees. What causes that? Okay, living life, walking around. Your knees are literally the first joints usually. They're the most stressed, particularly if you don't have perfectly straight legs, and most people don't. If you have, bow legs, or if you're not knee, either way, that changes the angle of the knee and puts stress on either the inside or the outside portion. Most people have osteoarthritis of the knee or degenerative joint disease, which means basically your knees have been worn out by life. Just, they've gotten older and they're wearing out. And so one of the natural things that you can do for that is take a supplement called glucosamine and chondroitin. These two things have always been over the counter. They are supplements that naturopaths have been using and recommending for years, but they are just in the last, say, decade become really popular with people because they are the only thing that you can take that will repair the joints. Everything else just decreases the inflammation, helps monitor and modify the pain, but don't fix anything. Now, we are now seeing injections with plasma fresh protein, PFP. It's made from your own body. These things are allowing the body to create new cartilages and to heal. So the plasma fresh proteins are very, very good for that. You might have seen people advertising or promoting them. There are people that think these shots are the greatest thing ever. And I've had people that got the shots and said they didn't get any benefit from them. So find a provider that is doing those injections and talk to them and see what they can offer you and see if that will help. The traditional injections that they do in the knee, first they start off with just an anti-inflammatory steroid injection and just an anesthetic like lidocaine or marcaine, a longer acting anesthetic. If that seems to give you some relief, if your knees start to wear out and you hear the term bone on bone, then there's an artificial cartilage that can be injected into your knee. It's a liquid, but it quickly forms up and creates a pad between the thigh bone and the leg bone, and it can give you lifelong relief, or it may last for 6 months to a year or multiple years. The most common product is a product called Symvist, Synbisc. Symvist is a product but there are multiple brands now that are out there that can give you relief, and all orthopedists are doing it, but a lot of primary care doctors are doing the procedure in the office and injecting knees and giving people some relief. So hope your knees get better. You can always take an anti-inflammatory, Motrin, Advil, or Aleve over-the-counter doses, prescription strength, ibuprofen or naproxen, diclofenac. There's a gel product called Voltaren gel that is now over the counter that you just rub on the outside and it's absorbed, and a lot of people swear that it gives them great relief as well. That is diclofenac, an oral anti-inflammatory that also gives you great benefit topically without irritating your stomach. So great question, Sandra.